I am Alexandra Murray-Zmijewski. I am the Public Financial Management Lead in the Health Financing Hub at Oxford Policy Management. The OPM Health Team's approach to capacity building is focused on the idea that knowledge is not a commodity. We make our approach adaptive to the country setting that we're in, and we are collaborative and participatory with our clients about what needs to be done. There are three types of capacity building which we identify within our projects that we work in health. One is implicit capacity building, where we assume that we'll be working on the project, we're working together with government officials, we will learn from each other, we will improve both knowledge. However, quite often that capacity building falls to the wayside and it is a case of capacity substitution. We have done the work in there quickly and out. The second type of capacity building we've identified that we work in is where a project has explicit capacity development within it, but this would be a training, a workshop, some type of dissemination of information of the findings that we have to government officials or policymakers. This also isn't optimal because it's not institutionalized, systematic capacity building. The third is what we'd like to do more of, dedicated capacity building. This is looking at really considering planning what governments need, what policymakers need, what do we learn from them, where do we work together, how can we get the theory and some evidence from other countries, put it together, make it country specific and learn from that country of how this is best going to work in this situation. So for us to implement dedicated capacity building and hopefully in the long term put ourselves out of work, we need to plan better, manage better, try to insert more of this dedicated capacity ideas into projects. An example of dedicated capacity building that OPM Health Team has done is based in Nigeria. The project was on results-based financing. We realised that there was a severe capacity gap, that once we finished the project, there would be nobody to continue. So we put a year-long training course in place, which was a mix of theory, practice, and on-the-job mentoring. Capacity building in Nigeria was based in the States. We used health financing government officials. We helped train them within their state realities on the job mentoring, as well as the theoretical and practical examples we provided. After 1 year, the 14 people graduated as experts in results-based financing. The project is being scaled up, and these 14 core results-based financing experts are now going to help roll out the training across the country.